Alright, let's get started. So, got a signature. She forgot to mess up the date. She put the initials. Put that aside. Alright. Oh, let's look at it. Nothing in the back. Nothing on the back. Nothing on the back. Alright. And we have Leanya gonna help us out. Everything is Leanya. Board is empty. There. I'll have the water bottle, has nothing on it. Alright. Envelope. 2. But she definitely didn't want me to get in it. Miss Bruin. I gotta redo it. You know I didn't need to redo it. Try my hardest not to rip it, but it's already ripped.
She's like, she's not redoing this bad boy.
I know, you told me I should redo it. Very nervous. Alright. Just took it out. Leanya's gonna read them. I'm gonna pick the card. Terrified. Okay. Alright, none of them. You can kind of see. She's getting the cards organized. Okay. Here we go. Alright. Pick. This is our topic. First one. Flip it back over.
What is happening inside the brain during an epileptic seizure?
A severe shock that goes to the brain.
What is the most common type of epileptic seizure?
Grand mal.
What occurs during the first phase of a grand mal seizure?
The patient has a personality change and they have an aura.
Second phase?
The patient comes cautious, falls, starts foaming at the mouth.
Third?
The patient comes cautious, I can't say the word, cautious, and the patient wakes up, okay, and is very confused.
What is a petite seizure?
A petite seizure is when they lose awareness and they are still awake, but like a deep stare.
Why is a status epilepticus seizure so dangerous?
It's dangerous because they happen back to back to back, or every time it happens back to back to back, they can be longer and it can cause death.
What is the very first thing you should do?
Code blue, code blue.
What are the 4 things your classmates should get?
Emergency clipboard, emergency kit, AED, and oxygen because they need some air.
What position should you put your patient in?
Supine.
Why is it important to know the toxic limit of lidocaine?
It can cause a seizure.
How often should you take vitals?
At least every 5 minutes.
If your patient is having a seizure that has lasted for 8 minutes, should you call 911 and why?
You should call 911 because it can cause a status epilepticus. I think I said it wrong, but it's You got the thing. Epilepticus.
What is the most important thing we can do to help a patient who is having a seizure?
You can move everything around them that is very harmless so they don't harm themselves.
Name 3 drugs that are commonly used to prevent seizures.
Carpital, and then dilatane, something like that is dilla something.
Where should you document everything that occurs during an emergency?
Record of treatment and medical emergency form.
Where should you remain
Remain with your patient until all times, until EMS arrives or if everything is resolved. There you go. I had to word it correctly.
What is the number one thing you can do to prevent an emergency?
Take a good medical history.
All right, choose a new one.
Pick.
You want me to pick?
Yeah. First one. Hold on, let me see if I can say it. Emphysema. Emphysema? Emphysema. Oh, I said it right.
What does COPD stand for?
Chronic, obstructive, pulmonary disease.
Is emphysema a form of COPD?
Yes, ma'am.
What effect does emphysema have on the lungs?
Destruction of the alveoli.
What is the leading cause of emphysema?
Hold on, I didn't finish.
Sorry.
Destruction of the alveoli, and it lowers the oxygen level. There you go.
What is the leading cause of emphysema?
Smoking.
What
Don't smoke.
What are common symptoms of patients who have emphysema?
Shortness of breath, coughing, and a little, like can't think of the word, but you can't do certain exercises.
What drug would you want to administer to a patient who is having an attack from emphysema and why?
Bronchial dilator to dilate the bronchioles.
What is the maximum amount of oxygen that you can give to a patient?
2 to 4 liters per minute.
What stimulates the reflex to breathe?
Low oxygen levels.
What are the 4 things they should get?
A medical emergency kit. What am I talking about? Emergency kit, emergency clipboard, AED, and oxygen.
What position should a patient be in and why?
Upright to let the patient breathe easier.
What type of vaccination should they get?
Influenza and pneumonia.
How often should we take vitals?
At least every 5 minutes, like I've already said.
Should they smoke?
Are you crazy? No.
First, should you document everything?
Medical emergency form and record of treatment.
Where should you remain?
Remain with your patient at all times until the emergency is resolved.
What's the number one thing you can do?
You better take a good medical history or they're gonna die.
Choose your next one.
Go ahead, pick. I'm about to cry. Can you pick one already? Thank you. Oh, allergic reaction. Oh.
What is an allergic reaction?
A exposure to a foreign object.
Which type of allergic reaction occurs usually within a few minutes and may be fatal if not treated properly?
Type 1.
Which antibody is involved in type 1?
IgE.
Does an allergic reaction occur the first time?
No.
What effect does histamine have on bronchioles and blood vessels?
Blood vessels dilate, bronchioles constrict.
How does histamine cause edema and difficulty breathing?
The blood vessels dilate, so that allows the liquid to leak, and that will cause swelling. Then the swelling will go everywhere, and then your tongue will start to swell up, and then it's harder to breathe.
If your patient tells you that their tongue is beginning to swell, they are itching all over, and their throat is beginning to close up, what type of allergy do you think they're having?
Type 1.
What is the first drug you should administer to a patient having type 1?
EpiPen.
What 4 things should your classmate get?
Emergency kit, emergency clipboard, AED, and oxygen.
You have given your type 1 patient an EpiPen. They are still struggling. What do you give them? And how much?
You give them 50 milligrams of ibuprofen.
Is a type 4 allergic reaction the result of a cell-mediated or a humoral immune response?
Cell ameliorated. You know what I'm trying to say here. I just can't see.
How often should we take vitals?
At least every 5 minutes.
What is the number one cell involved in type 4?
T cells.
What do mast cells cause to be released?
So, lysosomes and then it's the word cytoplasms, and it's considered the cytoplastic. I could at least spell it as CYTE, cytoplastic, something like that. I can't say it. You get the gist. Okay, continue.
What medicines could you use to treat a patient who is having a type 4 allergic reaction?
You can give Benadryl, liquid Benadryl, 2 to 4 teaspoons.
Where should you document everything?
Record of treatment, emergency, and medical emergency form.
Where should you remain?
Remain with the patient at all times until emergency is resolved.
Number one thing you can do?
Take a good medical history.
What is the most effective drug at treating type 1 allergic reaction?
Epinephrine. I said it right. Alright, next. Diabetes.
Where is insulin produced and what is its function?
It's produced in the pancreas and to allow to increase the energy levels in the muscles and tissues.
What is glycogen?
Glycogen is stored excess glucose.
Why is it important that glucose be constantly provided to the cells of the brain?
Only source of energy, duh.
What type of diabetic requires injections of insulin, type 1 or 2?
Type 1.
How do most type 2 diabetics manage their disease on a daily basis?
Diet.
What percent of diabetics are type 1 and what percent are type 2?
15% for type 1, 85% type 2.
What causes gestational diabetes and during which trimester does it typically occur?
All right, so the pancreas starts to develop hormones. No, not the pancreas, the placenta. There you go. The placenta starts to provide hormones, and then it is produced in the 2nd to 3rd trimester. I'm an idiot.
What is hypoglycemia and what are the symptoms?
Hypo is too little glucose, too little glucose, and then it is, what is it? Hold on. Sweating. They're not enough. No, a lot of saliva. Jittery. You got the gist of that one.
What would you give to a patient who is hypo?
Something sweet.
What is hyper and what are the symptoms?
Hyper is too much glucose, and there are not enough saliva, dry skin, and not hungry. Continue.
If your patient were conscious and hyperglycemic, what would you suggest to them?
Take your insulin. Duh.
How often should you take vitals?
Take vitals at least every 5 minutes.
If your patient is having a diabetic emergency and you are unsure whether they are hypo or hyper, how would you treat them?
Give them something sweet because they can have too much glucose in their body, and the glucose can turn into other items if they need to.
Which patient would better be treated with an injection of glucagon, a hypo, or a hyper, and why?
Hypo, because they don't have enough glucose.
You notice that the diabetic patient has a sweet, fruity smelling breath. What emergencies should you prepare for?
Hyper.
Where should you document everything?
Medical emergency form
If your
and
patient...
record of release. Can I finish?
Sorry. If your patient has an emergency, where should you remain?
Remain with your patient at all times until the medical emergency is resolved.
And what questions should you ask before treatment?
All right, you're gonna ask them, when did they take their glucose levels, their sugars? When did you? What was it? And what did you eat? When did you eat? And is that it? All right. Bye.